All right, I'm going to teach you everything you need to know about non-steroidal anti-inflammatory drugs, aka NSAIDs, used to treat inflammation, fever, and pain. They work by blocking prostaglandin synthesis, a process that begins with arachidonic acid, a membrane lipid component released by phospholipase A2 after cell injury. Cyclooxygenase enzymes convert that arachidonic acid into what are called prostanoids. COX-1 is involved in housekeeping roles like protecting the gastric mucosa, supporting renal blood flow, and activating platelets via thromboxane A2. COX-2 is upregulated in response to inflammation and produces prostaglandins responsible for fever, pain sensitivity, and increased vascular permeability. Prostacyclin, synthesized by COX-2 and the endothelium, causes vasodilation, and it inhibits platelet aggregation, helping maintain a non-thrombogenic vessel surface. NSAIDs reversibly inhibit both COX-1 and COX-2, which gives NSAIDs their anti-inflammatory, antipyretic, and analgesic properties. Of course, you know ibuprofen, but other COX blockers are diclofenac and ketorolac, indomethacin, meloxicam and piroxicam, and naproxen. NSAIDs have some important side effects to remember. A key side effect of COX-1 inhibition is gastric mucosal damage, leading to gastritis and ulcers and GI bleeding. And because NSAIDs impair platelet function via COX-1 inhibition, they can prolong bleeding time, especially in patients with underlying platelet disorders. They can increase blood pressure, and NSAIDs are among the most common causes of acute interstitial nephritis. An important renal complication is NSAID-induced afferent arterial vasoconstriction, reducing glomerular perfusion and GFR, which can precipitate AKI. This GFR drop can worsen renal handling of medications like lithium, potentially leading to lithium toxicity. Rarely, NSAIDs, especially indomethacin, may cause aplastic anemia, and they can induce hyperkalemia via decreased renin and aldosterone production. Aspirin irreversibly inhibits both COX-1 and COX-2 by acetylation. Aspirin is important in managing a child's Kawasaki disease for anti-inflammatory and later antiplatelet therapy. But aspirin's use in children with viral illnesses can cause Reye syndrome, a life-threatening encephalopathy with hepatic dysfunction. Aspirin toxicity may cause respiratory alkalosis, followed by anion gap metabolic acidosis. Aspirin toxicity can also cause tinnitus. Treatment for aspirin toxicity includes activated charcoal and sodium bicarbonate to alkalinize the serum and urine. And that's it. There's a bunch more in the full lesson, which you can check out at sketchy.com.